The Great Day Houston. We are starting with a health issue that is not life-threatening, but it is life-altering. It impacts self-esteem, it limits social interactions, and it can cost you in the amount of ruined clothing. It's called hyperhidrosis, or excessive sweating, especially under the arms. And it even happens in well air-conditioned rooms or when it's cold outside. There's actually an International Hyperhidrosis Society serving as a support group. One member wrote that his underarms sweat so much that he stopped going to class to avoid being made fun of, and trying to date was out of the question. Others wear heavy sweaters even in the summertime. Can you imagine doing that here to hide the sweat rings? Another stated that it made his career in sales difficult because clients were shocked by how much he was sweating. As the saying goes, necessity is the mother of invention. MiraDry is a technology that can permanently reduce sweating, odor, and underarm hair growth. Another issue many people feel just gets in the way, stubborn fat that won't go away around the midsection, tummy, back, and sides. That needs to be dealt with all the way around. Joining us with how Lipo360 works is Dr. Paul Fortes with the Aesthetic Center for Plastic Surgery, or ACPS. And to address underarm sweating is Travis Herzog with the ACPS Med Spa. Good morning, gentlemen.
Good morning, Deborah.
Okay, two things people are needing right now.
Yeah.
All right. Let me start with the fact that when people are looking for people to do certain techniques or procedures, it's a good idea to first check the validity of what they do, if you will. Dr. Fortes, you are double board certified. Check those certifications.
Yeah, that's important because it just says that the person who is double board certified, the doctor who's double board certified or single board certified, has met a very high standard for his area of expertise.
Yeah.
And that's so important because, I mean, people need to have high standards when they go for these treatments.
And experience.
Yeah.
Yeah, all right. And the same thing, Travis, holds true for even estheticians. You are licensed, so check for those licenses.
Right, exactly.
Yeah, because you do all kinds of things. You specialize in non-invasive and minimally invasive treatments, and sometimes people think non-invasive, well, anybody could do that.
Right,
no, you got to know how to do that. Chemical pills, facials, advanced laser therapies, microneedling, all that type of stuff to make us just prettier. Yeah. Okay, I have a confession to make about the sweating. Out of the blue, for some reason, I would sweat so much that I would walk around with paper towels and I would shove them under my arms. And when they say life altering, it was. It changed what I could wear. It was embarrassing. One day, the paper towel at an evening event came sneaking out, and someone thought I was stuffing my bra. Okay, no, it was not stuffing. That's your category. We'll talk about that in just a minute. But let's talk about what is MiraDry. And by the way, I was part of the trials for MiraDry, and I can attest that it does. Take a sniff. It does work. Yeah, right now.
I would have.
Yeah. Explain to me what MiraDry is.
So MiraDry is a non-invasive treatment. It's FDA approved, and it targets the deep layer of the dermal tissue and eliminates the sweat and odor glands.
Yeah. All right. So who does it benefit? Like when someone comes in, yeah.
Really, somebody that has hyperhidrosis or excessive sweating is what the device is made for. But I mean, it can be a good treatment for somebody that wants to reduce their use of deodorant, or someone that wants to feel more comfortable in social situations like you.
Yeah. All right. Take us through the process. How does it work?
So the treatment itself takes about an hour. Like I said, the device uses thermal microwave heat to target the deep layers of the tissue and destroy the sweat glands. And it also does remove some hair as well, which is nice. One of our nurse injectors will come in and numb the area with lidocaine, which makes the treatment very, very comfortable. Yeah. And like I said, it's easy, quick.
Yeah. And how many sessions would somebody normally have?
So typically, we after one session you will see a result, but we always recommend 2 sessions done 90 days apart for best results.
Yeah. And permanent?
Permanent, yeah.
I can attest to that. That was probably, I don't know how many years ago.
Well, the effects are immediate.
Yeah.
So you don't have to wait.
Yeah.
There's a little bit of downtime, but effects are immediate.
Yeah. And you get to take care of that problem there. But I know people will ask the question, okay, if I'm not sweating under my arms, because we're made to sweat, we need to sweat, is that a problem?
So no, because we have millions of sweat glands all over our body, and our arms constitute for like 2% of those millions of sweat glands. So the rest are more than sufficient enough to regulate our body's temperature. Yeah. And after somebody has a treatment, they're going to sweat normally, through the other areas of their body.
Not extra someplace else, just how you normally do.
Yeah.
All right, let's get to that midsection. For a while there, we'd see people go, I want that flat tummy, and who doesn't want a flat tummy, right? But they would get the flat tummy, and you go, okay, but there's stuff popping out all the way on the round of the whole bit. So that's where that idea of Lipo360 going all the way around to contour better.
Right. Well, you said it perfectly. It's contouring. And I've always done it this way because it made sense to do it this way. Why stop at arbitrary points when really It's the entire
Yeah. The desired look you're
body
trying to get is not just that.
that
yeah.
needs attention. So you get the treatment of the abdomen, of the waist, of the back, and you get a better shape.
Yeah, yeah. All right. So when we do that, we say lipo. Okay, we know what it takes to get a tummy tuck. So this is the importance of coming in and getting a consultation, because sometimes it might be the tummy tuck that you need.
Right.
Other times it might be, you mentioned contouring. So I want to make sure people understand this is not a weight loss tool. This is contouring. So people within about what range of weight they should be?
You know, I have a cutoff of BMI, body mass index, of 40, and that's pretty generous. I think when patients are too heavy, they sometimes rely on liposuction as a quick fix and as a means of weight management, and unfortunately, long term, that's not the solution.
Yeah.
There are other things that are more lifestyle changes that are important for managing weight, but in terms of contouring and shaping the body, liposuction is the way to do it.
Yeah.
Because we are genetically predetermined to have certain body features, and maybe to hold fat in the tummy and then the love handles or in the thighs and certain body shapes that are perhaps not ideal, and so
And no matter how much you work out or diet, it just that's where your fat cells are mostly centered.
Exactly.
Right?
So that's where liposuction comes in and works great, because something that is not naturally available to a person, I can achieve in a few hours in the operating room.
Yeah. All right. What's the downtime?
I say to patients, expect a few days of drainage, which is completely normal, and probably before the end of the week, you're back to driving, back to the office, and maybe 4 to 6 weeks, full unrestricted activities.
Yeah.
Even going to the gym, even wearing a bathing suit.
Yeah.
Going-
And because liposuction, I know we've seen different versions of it. Is this a one that you can recover from obviously quicker?
Standard liposuction, you know, is old-fashioned. It's not sexy, but it's still effective. And you know, over the last several years, there have been different kinds of liposuction develop, ultrasound, heat energy liposuctions. The standard liposuction is still effective, and it's the one that I use to achieve the results.
And so the thing is, once you start looking good there, you start thinking, now wait a minute. Well, y'all are like the full meal deal. You can do anything in terms of plastic surgery. One of the most popular still is breast augmentation.
Yeah. Oh, absolutely. It always ranks with liposuction in women as number 1 or number 2, most popular procedures in all of plastic surgery.
Facelifts, you know, full or partial, eyes, eye lifts, you fix hooded eyes, rhinoplasties, whatever it is you're staring in the mirror that you're not happy with. Sometimes it's just because of aging, sometimes it's because of what your genetics is. Y'all can tweak it and fix it and get us what we want.
Absolutely.
All right, like I asked him about my neck when I walked into the green room, and he said, I don't see it.
She has a great neck.
Well, no, but sometimes we see things that y'all don't see. All right. And of course, the med spas we mentioned earlier too, various aesthetic procedures. Sometimes you can do a lot of those things before you get to your department, and that can
Or
just
in
buy you some
conjunction
time.
with as well.
Yeah, or in conjunction with. There you go. There's a team over here.
Yeah.
Okay. The Aesthetic Center for Plastic Surgery is offering special promotions. Receive 15% off Lipo360 with Dr. Fortes, or $750 per month for 12 months with 0% interest. You can also receive 15% off your 2 MiraDry treatments with Travis at their ACPS Med Spa. To schedule an appointment, give them a call at this number. It's 346-258-7776. Again, that's 346-258-7776, or visit them online at mybeautifulbody.com.